welcome to all those of you who are joining us online across the different platforms. We're live on Facebook, YouTube, LinkedIn, as well as Twitter. So wherever you may be, whatever time of the day it may be for you, a warm welcome to you. This is the very first Lightning Chat in a series ahead of the WHO Scholar Level 1 certification on Immunization Agenda 2030. If you're not familiar with Immunization Agenda 2030 yet, well, this is one good reason to stay. We'll be talking today specifically with Lochlainn and her colleague Akinola Fatiregun about missed opportunities for vaccination. And we'll be starting in just over 3 minutes, so stay tuned, and we'll be right back. We'll be looking at your comments and questions. Do let us know where you're connecting from, the city and country, and please say hello. We're just 2 minutes away from our first Lightning Chat ahead of the WHO Scholar Level 1 certification on Immunization Agenda 2030. That's quite a mouthful, but today in this chat we're going to be talking about missed opportunities for vaccination and what to do about them with Lochlainn from the World Health Organization and her colleague Akinola Fatiregun. We'll be right back in 1 minute and 30 seconds.
O Falalaye, O Kalimbaye, Naye Shimawe.
Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, here today with Lochlainn and Akinola Fatiregun. Laura is from the World Health Organization, and we are doing this first Lightning Chat in a series ahead of the WHO Scholar Level 1 certification on Immunization Agenda 2030. You can find out more about the course, which is starting soon, on the Geneva Learning Foundation website. But let's dive right in. I'm here, of course, with Charlotte and Mbuh. Charlotte, how are you doing today?
Hi, Reda. Hi, everyone. I'm doing great. Thank you.
All right, the principle of the Lightning Chat is simple. It is very quick because we know how busy you are working in countries on COVID-19 vaccination and facing many other challenges. So in 15 minutes, we're going to ask some of the basic questions to Laura, and then we're going to be looking for your questions both online and in the Zoom room. And we'll keep going as long as we get questions, up to 30 minutes, but we'll stop at 15 if really no one has any questions about missed opportunities for vaccination. So welcome to you, Laura. How are you doing? And then we'll hand it over to Charlotte.
Great, thanks, Reda. Great to have everyone online, and look forward to talking about missed opportunities for vaccination with you all.
All right, let's dive in. Charlotte, what is your first question?
Okay, thank you, Reda. So, and it's great to meet you again, Laura. So please, can you just kindly introduce yourself? Tell us what you do, WHO IVP, and let's know who you are.
Great. So my name is Lochlainn. I work in the Immunization Department here at WHO HQ in Geneva, but not in the office, still working from home for over a year. I work in life course and integration in the Essential Programme in Immunization. And within that, I cover missed opportunities for vaccination. I also work in home-based records, as well as life course work, and also integration related activities. And I'd like to introduce a colleague who's joined us from the Nigeria office in Ondo State. Akinola, if you can introduce yourself and tell everyone on the line what you're doing.
Yeah, thank you, Laura. I'm Akinola Fatiregun. I'm from Nigeria and work with the World Health Organization as a state coordinator in one of the 37 states in the country. I'm in Ondo State of Nigeria. I work in Akure. And I was part of the WHO Scholar course in 2019 on reducing inequities and improving coverage. Over. Thank you. Over.
Thanks.
Okay, pleased to meet you, Akinola. So, Laura, my first question goes to you.
Before we go to your first question, we first need to acknowledge the folks who have joined us online. Just to say hello to Jean-Paul Kanda, Lara Adeyemi connecting from the USA, Merciano Peters watching from Nigeria, who says she's glad to be here. Flore Mendeng, who says bonjour à tous. Bakari Caroline Ajoke from Nigeria, who says great job. Asta Monglo from Brazzaville in the Republic of Congo. And Narendra Rato Voniaina, who says hello everyone from Madagascar. Hello back. And unfortunately, we won't be able to greet everyone, but I wanted to get a few in there, Charlotte, before we dive into the questions. Back to you.
Okay, Reda, great. So, Laura, what are missed opportunities for vaccination?
So we have a clear definition for what a missed opportunity for vaccination is. And this is any contact with health services by a child or an adult who is eligible for vaccination, which does not result in the person receiving all the vaccine doses for which he or she is eligible. So that's how we define MOV. But what I want to emphasize is that there's a difference between MOV and missed children. So when we talk about missed opportunities for vaccination, we're talking about people who are in contact with the health service. So what we see, and Akinola can attest to this, is in MOV assessments, we see that people who come for immunization or for other health services who leave without getting all the eligible doses that they are due for. So Akinola, do you want to talk a little bit about the missed opportunities vaccination assessment that you did in Ondo State, and how much MOV, the prevalence of MOV you found from that assessment?
Yeah, thank you very much, Laura. Like I mentioned earlier, I was part of the Scholar course in 2019, where we developed a proposal, on the assessment of MOV for the state, and it was successful. And in December 2019, I was joined with my colleagues in the Ministry of Health and other immunization partners, and we carried out this assessment with the objectives of determining the magnitude of MOV among children 0 to 23 months, visiting health facilities. Just like we've said, they must have had contact with the health facility. And we carry out the assessment in three zones, in 3 local governments of the states, out of the 18 local governments, representing each of the 3 districts that we have, political districts. And we went even to these health facilities that are conducting routine immunization. Our team of interviewers interview mothers as well as health workers, as they were receiving as they were coming out of the clinic, the mothers, the caregivers. And at the end of the day, we had 62% of the children with valid vaccination documentation, because we actually use the home-based card, the vaccination card, to validate whether to assess the history for the history of the vaccination and to validate MOV. So for those that had valid documentation, about 869 of them, 62% of them had this documentation. And among these 62%, 33% of them, experienced MOV, and MOV was found to be more among those that are visiting, that are coming for non-vaccination visits, like medical consultation, child visit, child accompanying a child, or for hospitalization. And over there, we found about 90.8%, of our sample to actually having missed opportunity among those that are visiting for non-vaccination. And then, of course, even for those that came for vaccination, about 7.3% of them who are eligible, they are eligible, and the doses are due, and yet they still missed. About 7.3% of them were still missed. So the MOV assessment that we conducted in Ondo State, we found on the average 1 in 3 children who are eligible for vaccination experiencing MOV. And the proportion of MOV was higher among children who were at the facilities, like I said, for non-vaccination visits, despite having had contact with the health system. So the MOV, we thought may have occurred from the evidence we gathered from the qualitative aspects of and the brainstorming exercise that we had following the 10 steps of WHO methodology. One, lack of institutionalized screening of vaccination documentation by health workers, especially those providing non-vaccination services. And the fact that caregivers are not bringing their cards to the health facility, there are non-availability of vaccination service on all days of the week, and there are shortages among distribution of health workers across these health facilities. Then multi-dose via policies also is concern among health workers. So those are some of the reasons that we had. And of course, we are considering the next steps, that is what we need to do to implement this, which includes training of health workers, especially those at non-immunization sites, on how to screen vaccination cards, at every health contact. And then we're also planning to designate at least one health facility per ward, to be conducting daily vaccinations. Those health facilities will have facility for to store their vaccine, and the health facility upon referral system is also being looked into, so that we can track extra doses given during this period. Then communication to caregivers using healthcare workers, jingles on radio, and other mass media are also being considered. And we also intend to intensify our supportive supervision on reducing MOV. And of course, we think that it will be good for us to have a follow-up assessment after about 12 months of implementation. So that is the experience so far with MOV in Ondo State. Over. Thank you.
Thanks, Akinnola. That was a really rapid run through of really a very extensive assessment and analysis that happened following that. So thank you. But what Akinnola has described is really what we see in many countries, is that we see children who are coming to health facilities, eligible for vaccination, and leaving without getting the vaccines that they're due for. And this is where we have these MOVs occurring. And we see in many countries that increased MOV is occurring for people who come for non-vaccination visits, which is understandable, but it links into the fact that there isn't clear referral systems, or that health workers are not screening the vaccination card or home-based record to check if the child is eligible for vaccination.
Thank you, Laura, and thank you, Akinnola. That sounds like a fascinating summary of a fascinating study. We might want to take a step back, because Joyce wants to know, why are you calling them opportunities? And then we have 2 more questions from Ameas Tabuba and Mercionu Peters, which we'll get to. So why refer to them as missed opportunities for vaccination?
Okay, good question, Joyce. I think what we're talking about, and as I mentioned at the beginning, is that when someone is at a health facility, that is an opportunity for them to be screened and referred or given vaccines that they're due. So what we are seeing in these assessments that we are conducting is that people have the opportunity, but unfortunately, in many cases, the health worker either doesn't provide the vaccine, and there are many reasons. Sometimes it can be, as Akinola mentioned, some fear wastage. So health workers may not open a multi-dose vial. Sometimes it may be because there's valid or invalid contraindications. So a child may have fever, so the health worker then won't get the vaccine when in fact the child could have been due the vaccine. So there are many, many reasons why we see that there is missed opportunities. So that's why we use the term opportunity, because the opportunity is there. These people are physically in the health facility. We don't need to do anything to try and get them to come. They're there. But what we're seeing is that people who are still making the effort to come to visit our health facilities, they're not receiving the vaccine doses that they are due. So that's why we have this term, missed opportunity for vaccination. It's been around for a long time, this term. So I think the first guidance came out in 1988. So I think hopefully that explains, but this is where people are physically present, but they're not getting the opportunity to be vaccinated.
All right, we have a question from Aimee Astabuba from Facebook. Now, she says, MOV are mostly due, in the context I worked in, to lack of integration of activities and strong program verticality. And she asks a question: how can you help us overcome these issues?
Yeah, I think this issue of not having proper cross-referral, or that health workers feel like they have one duty and they sometimes can't go outside of that duty, is sometimes the reasons that we see this verticalization happening and this lack of integration. How we can make it improved is it's about having the discussions and ensuring that when we think about immunization, we offer growth monitoring. Vitamin A is given during immunization sessions in many countries. But when a child goes for another contact, a lot of the times there is no discussion about what could be done for the immunization side. So it's about having these discussions. And in many countries, there's integrated management of childhood illnesses. There's a checklist that's meant to happen when a child comes for every health contact. But we know that that is not being implemented in every country. Otherwise, we wouldn't be seeing these missed opportunities for vaccination. But as Akinola mentioned, having some form of system in place whereby all health workers look at the home-based record, and then either, if they can provide the vaccine, or refer the child to the immunization center so that they can receive the vaccine doses they are due. And that is hopefully one of the initiatives that they're going to try and implement in Ondo State, to see if they can increase coverage by ensuring that children who are present in a health facility will be screened and then receive vaccines that they're due.
Thank you, Laura. The next question comes from the chat here with the course participants. So we have Enta Nana Rivo Enja Rasoa from Madagascar, who asked a question in French. Often people come to consult in the health facilities. They don't bring their vaccination card with them. How do we then count their doses in these centers in such situations?
Great question. And we will be having another lightning chat dedicated to home-based records in a couple of weeks' time, because this is a big problem and it's something that comes up a lot in our missed opportunity for vaccination assessments. So depending on the country, we see in some countries, caregivers are really, it's reinforced from the very, very beginning that they should bring the home-based record to every health contact. So in many countries, we see that caregivers will bring the home-based record. So that's not an issue. However, if the caregiver forgets to bring the home-based record, having the health facility register is the next port of call, whereby the health worker will have to go through that health facility register and see what those doses that child is due. It's much more time consuming But that is another opportunity. Also, in other countries, they have tickler systems or some form of keeping track of those who are not up to date. So that's why there are many opportunities out there to try and keep track. But I think the home-based record is the key one, and ensuring that caregivers are aware of bringing it to every health contact. That's the key thing. And from an immunization point of view, we're understanding more and more that we place a huge amount of importance on the home-based record compared to other disease program areas. Because we use the information in the home-based records for coverage surveys, for even when we're doing periodic intensification routine immunization or other outreach activities, we're very reliant on the home-based record. So that's why if in your country that this is a problem where some people are not bringing their home-based record to the every health contact, I think it's important that messaging starts to happen whereby people are some health promotion around the importance of bringing it is shared widely.
Thank you, Laura. I see Mireille Mutuale has her hand up, so I'm going to see. I try to unmute her once, and do raise your hand if you'd like to. If it's easier for you to explain or present your question.
Merci Laura pour la présentation et avec votre collègue. Ma préoccupation est celle-ci. J'ai bien suivi par rapport aux occasions manquées. La RDC, elle est confrontée par rapport à un nombre d'enfants insuffisamment vaccinés à cause de ces occasions manquées. Dans les occasions manquées, soit c'est lié aussi parce qu'on ne connaît pas les dénominateurs. Et de deux, les occasions manquées aussi chez nous, je ne sais pas si on peut le dire, c'est par rapport aux ruptures de vaccins. Pour le moment là, la RDC connaît une rupture de vaccins traditionnels, dont on n'en a pas. Or, on s'est dit que les vaccins sont achetés en groupe, sont couplés. Les demandes de vaccins sont achetées. Comme on est dans la région d'Afrique, c'est que quand nous avons cette rupture, on s'est dit que la commande n'est pas encore faite au niveau de groupe régional. Et je me dis, par rapport à cette réalité, on a du mal à récupérer ces enfants. Même si vous dites que la prise en charge de nos enfants, lorsqu'ils se présentent à l'hôpital, effectivement, ça s'est fait par la prise en charge intégrée de maladies de l'enfant, la PCM, qui donne l'occasion à récupérer l'enfant et à récupérer son calendrier vaccinal. Mais c'est un dilemme pour nous, pour pallier à cette situation. Donc, nous resterons toujours dans cette conflit des enfants, des occasions manquées de vaccination. Mais maintenant, par rapport à la stratégie est que lors de JLV, on essaye de récupérer ces enfants en conflit vaccinal. Et maintenant, là, nous préparons les JLV, mais nous n'avons pas de vaccin traditionnel. Donc, comment on peut pallier à cette situation? Merci.
Okay, thank you, Mireille. And it's we have carried out a MOV assessment previously in Kinshasa and also in another district in DRC, and the issue with supply is very problematic, and I understand that it's very difficult then, because if you have to turn people away because you don't have vaccine available, you don't know if they're going to come back. And I think this alludes to what I said previously about health facility registers. So having an up-to-date health facility register and keeping track of those who are not up to date. There's lots of different terms for it, but I'm not going to use some of the more, for those that maybe have dropped out of the system, that this is where engaging those in the community and trying to get people back into the health facility is really, really key. Because in many countries, we're reliant on other activities that are very costly and not sustainable, but really need to put more emphasis on what services we can deliver at the primary healthcare level. So that's why there are two things that are important: is the home-based record and the health facility register. If we have these two things up to date, then when we do have an opportunity and time, reviewing those and checking if everyone's up to date, that's how we try and keep those people up to date with their vaccinations. But on the other side, from the supply side, and that issue, that's a national level and regional level issue. And I know that in many countries that there's big challenges with health workers having to go to certain stores before an immunization session because they don't have a fridge in their health facility. I know it's very challenging, but I think the main thing is we have to communicate these challenges. They can't be dealt with on their own. So I think ensuring that there is correct supply is a key responsibility of those at the regional and national level. And it does lead to huge amounts of missed opportunities. And it's a really unfortunate thing. So, but I think documenting and making people aware that this is occurring is the only way that we can try and ensure that there is opportunity for change.
Thank you, Laura. So we have questions flowing in. We are already technically 6 minutes over time, and that's by design. So this is called a lightning chat. We're not going to exhaust, obviously, the topic or your questions, but we do want to give you 2 avenues if you're interested in exploring further, and hope this has stirred your intrinsic motivation to do so. So we're going to take a few more questions, but there are 2 avenues for if you would like to know more. Everyone who's attended here, and then we'll also be posting in the comments on the different platforms where many of you are watching this lightning chat, will share the resources that Laura has prepared for you. And then for the course participants, we'll share a magic link where if you have additional questions or would like to sort of share more detail about your question, your situation, your context, you can actually submit that question to Lochlainn and her colleagues at the World Health Organization. So don't worry, this is not it. This is just the beginning of a conversation we'll be having in the coming weeks and with Immunization Agenda 2030, perhaps in the coming years. So I want to now go to a question from Imam Wadabelo, who is connecting on and listening in on Facebook. And first of all, he says, hello, everyone. And his question is the following: what role can the traditional and community leaders play in addressing the issue of missed opportunities and defaulter tracking? He also says, nice lecture. He's connecting from Kano, Nigeria.
Thank you. And Akinola, if you want to address this, I'm happy to pass over to you. I don't know if he's still available because he was also in another meeting. Go ahead, Akinola.
Hello. Could you repeat the question? Sorry.
Sure. So it's Imam Wadabelo from Kano, Nigeria, who says, what role can the traditional and community leaders play in addressing the issue of missed opportunities and defaulter tracking?
Yeah, thank you very much. Yes, they have a very great role to play. For instance, in the assessment that we're trying to do, the implementation of the assessments, part of the thing that we are planning is actually to sensitize the communities, about the need for them, to bring up their cards anytime they are visiting the health facility. So we can use the community leaders and all those within that structure actually, to encourage caregivers to always go to the health facilities with their cards so that during that period it could be screened, and then if there's need for referral for immunization, that will be done. So they have a great role in that regard. To sensitize the community members with regards to the MOV. And of course, for tracking of immunization, of course, it's also important. Once they are sensitized, they can also support even in referring patient claims that are due for immunization. Thank you. Over.
Thanks, Akinola. And I think ensuring if you have community leadership and traditional leaders, if you have their trust, and if the community are aware of their trust in the health system, then that can, of course, encourage them to go to the health facilities.
Thank you both. We have next a question from Mercy Onu-Peters, who wants to know, how do we manage missed children in underserved communities, especially very hard to reach with eligible children and availability of vaccine, but no means of transportation? And that's perhaps a distinction to distinguish the opportunity to distinguish missed opportunities for vaccination from other situations that can lead to children not receiving vaccines.
Thanks. Yeah, Reda, you're an MOV champion now because you know the definitions and the difference. So this is why a lot of the times we try to define that missed opportunity for vaccination that occurs amongst those at the health facility level. But in missed communities and those who are hard to reach, separate strategies are needed for those communities, because if they don't have access to health services, then the opportunity for them to get vaccinated isn't there, so it's not missed. But there are definitely different strategies that are out there for hard to reach populations, like reaching every district, and also Gavi, the Vaccine Alliance, and other immunization partners also are very keen to address these children. They're called zero dose children. So it's typically children who haven't received the first dose of their DTP. So I think that it's a much more complex situation, and that's why reducing missed opportunities is so much opportunity to reduce them, because we actually have the people at the health facility level. So when we talk about those other groups, it's hard to reach, they don't have transport, and it's much more difficult. But what we're seeing is we have people who actually do have transport, do have access to health services, but they're not getting vaccinated when they're at the health facility level. So that's why we've published on a number of assessments that have been done in a number of countries since 2015. And you'll see that there's themes that emerge from all these countries where we see that children are not getting screened, that health workers are not opening vials, that some health workers are feeling a little bit, they're lacking confidence in some of their expertise in immunization. So all these things can multiply and lead to people leaving a health facility level without the vaccines that they needed or that they were due.
Thanks, Laura. I want to turn now to Charlotte, who's been keeping an eye on the many, many good questions and comments from the course participants in the chat. And we have maybe, Charlotte, have you spotted maybe perhaps one or two questions or a comment to bring to Laura's and Akinola's attention for their feedback?
Yes, Reda, there are lots of questions and comments in the chat, but actually I'm going to identify one question and then one question from 99 Rin in the chat. He says, good day, everyone. In border areas, we implement catch-up plans for MOV, but due to different immunization schedules from border countries, how should we count the dose of vaccines if a child got the vaccine shot with different antigens from a border country?
Okay. Well, if it's a different, I understand that some countries may have penta and some may have hexa, but as long as they have received the dose, that component of that vaccine, then that should be counted in the home-based record as that specific dose. So it shouldn't matter. I'm not sure which specific vaccines you're referring to. Maybe in some countries they have measles only, and some countries have measles rubella. But as long as they have received the dose at the specific time, that's important, because at the end of the day, as long as a child has received the vaccine, then they're protected from those antigens. And then the recording issue in the home-based record can sometimes be problematic and cause confusion. I understand that. And having looked at thousands of pictures of home-based records from many different countries, I can understand that in the border countries, we can see that there are different sometimes schedules and sometimes vaccines. But I think we need to just ensure that as long as the child is there and the vaccines that are available were provided, then that's okay.
Okay, and I have a question, Laura. What happens to children whom, as a result of missed opportunities, are no more eligible to receive the vaccines? How can this be addressed?
That is a great question. And this is another reason why we see a lot of missed opportunities for vaccination. And I think when we talk about IA2030 and the immunization agenda for the next decade, we want everyone, everywhere, at every age to fully benefit from vaccines for good health and well-being. And there is a lot of emphasis put on upper age limits and restrictions on certain vaccines. But for many vaccines, we're advocating that if the child is eligible, or, for example, if the child was missed and that they should be caught up with that vaccine, irrespective of the cutoff. There are some vaccines that have certain recommendations for upper age limits, but for the most part, for example, in some countries, a child may have missed their measles vaccine at 9 months. And when they come to the health facility at 13, 14 months, some health workers won't give the child the measles vaccine because they're above 12 months. But in fact, measles vaccine can be given at any age. And it's much more beneficial to vaccinate that child at that moment than that child getting measles and then having to do campaigns because of measles outbreaks. So these are issues that arise a lot. And we know that a lot of the time that there's health worker concern about eligibility and upper age limits. But at WHO, we recommend that for catch-up vaccination that we try and it's better to give the vaccine late than never. That's really the advice that we give, because giving that vaccine is more important than the child never getting the vaccine. So that's a good question, and it's another reason why we see a lot of missed opportunities in many countries.
Thank you so much, Lochlainn and Akinola Fatiregun. This is only the beginning of longer conversation. This is the first of a series of lightning chats taking place ahead of the WHO Scholar Level 1 certification on the Immunization Agenda 2030. I'd like to ask you and all of the participants to, even if you're sitting alone in front of your computer screen, just to offer a round of applause both to our guests and to those of you who asked questions, made comments, or just engaged and thought about what was being said and how we can do better as immunization professionals. So, and also, last but not least, a reminder that tomorrow at 1 p.m. Geneva time, we'll be convening for this special event, part of the launch series of launch events for Immunization Agenda 2030. If you're curious, if you'd like to know more, you can go to the, of course, the WHO website as well as the Learning.Foundation website. We'll be sharing resources and the magic link so that if you have questions or you did not get the answer to your question, you can ask Laura and her colleagues, and we promise we'll get it to them and they will give due consideration to your question. Once again, thank you, take care, and see you soon.
Thank you.
Thank you.
Thank you.